assistant professor at Duke University, and I am a physician and a researcher in sickle cell and benign hematology. What brought me to, well, I go to ASH every year. So, so I would, even whether I was presenting or not, I would come to ASH because I like, seeing what's cutting edge. I want to see what's going on with gene therapy, but I came to present my research on older adults with sickle cell disease. So I came to present and to learn. So like I said, I study older adults. So it has like a two-part situation. So I develop assessment tools. So like how to measure function, how to measure how people are doing like in their day-to-day functioning as they get older. Because people with sickle cell disease, they typically, it was a pediatric disease, right? People died in the 1970s. They died like when they were teenagers, but now they're living much longer, 50s, 60s, even 80s. People are living longer. So there really needs to be management tools. So I consider myself a pioneer in the area of sickle cell and aging research. And I also develop interventions to be able to improve function in older adults with sickle cell disease, like as they age as well. So I'm sickle cell and aging expert. Now, I would say, gene therapy is interesting. It's interesting for those who can afford it. So yes, it's interesting. It's a transformative therapy. And I think even just being able to like give somebody better quality of life for the rest of their life, hopefully if it's that durable of a response, is very interesting and exciting. So yes, I'm interested, but I have concerns, of course, about the ability of, people being able to afford like a $3 million treatment. So there's concerns, especially for people that live in Africa and like, that there's gonna be so many people that are not gonna get that treatment. So it's like a bittersweet kind of a thing, but it is interesting though. I think the biggest gaps tend to be the gap between what we know works and what we actually do. Like this implementation gap, right? We know hydroxyurea is a really effective treatment in improving function and improving, reducing sickle cell pain crises and improving survival, like helping people live longer, right? We have a treatment that we know makes people live longer, but not everybody is prescribed it, right? So there's a gap between, we have a lot of data, there's so much data, but there's a gap between what we know and what we do. And so I think that is what people need to start thinking about, like how can we do more pragmatic studies, more practical studies where we can actually increase uptake of the things that we know work. So I think that's the biggest one. So I have a study called Sickle Fit, and it's basically an exercise intervention for people over 40 with sickle cell disease in order to help them improve function and quality of life. And in that study, I recruited a woman who was 82 years old with sickle cell disease, right? Never been on any treatments before, and she was somewhat frail. But actually, we got her interested in exercise. We got her interested in being more active. And basically, she finished the whole study and she did really, really well. And not only did she do well, but other participants in the study, seeing her in the study, actually were inspired by seeing an 82-year-old with sickle cell disease doing an exercise study. So that was, very inspiring and very exciting for me. And to see that in the research that I, am the PI for. So I'm very excited about that. I would probably go back to the Sickle Fit study. So, the Sickle Fit study really is about individualizing exercise for people with sickle cell disease. So, you take somebody who has an impairment, right? We know they may have really bad avascular necrosis in their joint. Typically, someone would say, oh, this person can't be active. Maybe they're going to stay sedentary. But physical activity improves survival. It's not just medicine, but activity. So, taking a personalized approach to that person that has that really bad impairment can actually help them and give them the confidence to exercise so they can get the benefits that we know work for people that are engaging in physical activity. So yes, I think personalization needs to be a part of every, single piece of work that we do. Right now we're doing a pilot study. So the Sickle Fit is currently in its pilot testing phase. So the most important thing that we are looking at now is it feasible? Can people do it, right? Can people even do it? Can they make it to the end? Is it safe? Because historically people have been afraid that high intensity exercise is not safe. And there's no data that shows that. And it's not that we're doing high intensity exercise, but there have been afraid to exercise people with sickle cell disease. So safety was a really big outcome measure that we wanted to see in sickle fit, and we showed that people can do sickle fit over the age of 40, even up to the age of 80. We show that it actually not only is feasible, but it's acceptable, where we had 93% of people say, I love it, right? I really enjoy doing it. And I actually wish it was longer, right? People wish the program was longer than 12 weeks. So we showed that, once you get people used to exercise and, they want to keep doing it, and these are people that were previously sedentary, that were afraid. And it's not that they had no pain crises during the study, they did, but having a clinician and an exercise expert kind of walking beside you when you're doing something you've never done before like this gives you the confidence to be able to do it and to keep doing it even when that provider is no longer there. Yeah, so we're still in the beginning stages, and we're going to enter into the efficacy stage of that next year, but it really is showing really promising results early on. So I'm excited about Sickle Fit. Sickle Fit. Check us out. Two things. The first two things that come to mind is don't be afraid to try things that have never been tried before. And the second thing is find a niche for yourself. I know, yes, try things, but eventually start to differentiate yourself in an area where you feel like there's not a lot of data, where a lot more help needs to be provided. So for me, I focus on adults with sickle cell disease, especially the older adult, because we didn't, they're often excluded from research. Like most studies kind of stop recruiting at age 40. So you have this big gap in knowledge for older adults where, and now more studies are recruiting people over the age of 40, but most of sickle cell research was done in kids and young adults. So, you find an area where there's a big gap. So that requires you to read and, know the literature and know what's missing. So you can say, here's where I can contribute, and contribute in a place that you're excited about, right? Things that make you happy and wake up in the morning and want to keep doing it. And so it's, you can have that balance between having something that you really enjoy and making a big difference. So I would advise you to do that. I would say a combination of the ASH newsletters that come out. They come out digitally and also on paper. I also stay up. We have actually noon conferences, and so we actually talk about cutting edge, research and things that are going on within our group in the educational space. So I would say those are my two ways of doing that. But I might check out MD Newsline, because it sounds like I can actually get what I need from MD Newsline. Check it out.